Welcome to Season 3 of the Old Nerd in the Gym Fitness Podcast. Our podcast is brought to you by GLD Enterprises Communications Limited. We are all about supporting the health and fitness of family caregivers and anyone else who wants to live better and stronger, physically and emotionally.
Our program is produced, engineered, and edited by Julie Barth and directed by Jerry Deere.
Now let's get started with this episode of the Old Nerd in the Gym Fitness Podcast with your hosts, Julie Barth and Jerry Deere. Hey everybody, welcome back to Old Nerd in the Gym Fitness Podcast. I am here, this is Jerry Deere, and I'm here with our hosts, our co-host, Julie Barth.
I get to talk today.
You get to talk today.
That's new. Hi, Jerry.
Hi, Julie. And our guest today on this episode of Old Nerd is Kim Vesey with Hospice, Ohio's Hospice of Dayton. Hi, Kim. How are you?
I'm doing well. Thank you.
Thanks for spending a little time for us today. We've already been talking before we started recording here that things are going to get goofy, so don't worry about that.
Appreciate the warning.
we
That's
do
not abnormal.
No, we do about one of these a month, and the topics are difficult, but Kim is an RN. How long have you been a nurse?
38 years.
38 years. So you spent how much of that did you spend in general practice nursing?
1 year at a hospital, and then the remainder's been in hospice.
Really?
Mm-hmm.
37 years in hospice. Wow. Okay. So our topic today is hospice, and we're going to try to keep it as pleasant as possible. It's a difficult discussion to have. So we're going to talk about having those difficult discussions, but I have some jokes for you. So you already heard it.
Not about hospice.
We figured the hospice jokes are a bad idea, so I'll get letters. Although it might kick up our listenership if I really piss people off.
Say something really obnoxious.
I'm allowed. Why do nurses hate the outdoors?
I have no idea.
Too much poison IV. These are pretty bad. Why did the nurse? Well, those will get put in. You don't have to do that.
I have wah-wah-wahs of grandpa.
Okay.
I get the trombone slide when these are bad. Why did the nurse need a red crayon?
Why?
She wanted to draw blood. What do transplant nurses hate?
I have no idea.
Rejection. If you don't know, go look it up. We try to teach people stuff here on Old Nerd,
Clearly.
Rejection is kind of the most common problem with a transplant, right? So I've just explained it too much.
How do you
clicking.
Know? 2 minutes in, you're already clicking.
I understand. There, she hates that. How do you know when a nurse is having a bad day?
Bedpans go flying.
Okay, I'll buy that.
Be.
That's not it. She won't stop needling people.
Been there, done that.
Somebody bothers you enough, you're like, it's not going to hurt, but it will a little bit more today because you're making me crazy.
I'm only going to give you one more.
Thank goodness.
Oh, no, there's two.
Oh,
I have to do this one first. Never upset a pediatric nurse. They have very little patience.
Aww.
That's
that was
fun.
good.
This
That was
one's
good.
awful. What did the nurse say to the man who fainted at the airport terminal? And appropriate for our conversation.
Oh, I don't know.
I think you might have a terminal illness.
Oh, goodness. There's a lot of illnesses.
There's a line
from a terminal.
There's a line there. All right, I'm going to
That's
get
a nice transition.
That's a good transition. And now, so much for...
And now our new host is... No.
I just got fired from my own podcast. So let's get started here. The reason I wanted to do this topic is because Kim, as you know, and of course Julie knows, and anybody that's read the Old Nerd blog or listened to this at all knows that I have personally been through the hospice process twice now, at least where I've had to handle things and do stuff like that.
Not quite as personally as yourself.
Well, no, because of my parents, but
you really only do
But this
once.
is about the caregiver. It's not about the patient.
Yes.
So the idea to think about is, it's a difficult conversation. And I remember the first time it came up, my mom was very, very ill. And my family wouldn't even talk about it because my dad heard the word hospice and he immediately heard, that's it, we've given up, it's over. And he was not a give up kind of guy.
I think it's similar to back in like the 60s and 70s, the big C word. No one would ever say the word cancer because that was,
very hard
to death.
Yeah, you couldn't really do anything for cancer in those days. So it's very similar, but I think the other thing is there's a lot of misconceptions, right?
Absolutely.
People have some weird ideas about it, and people have some weird ideas about why families need to take that route for a lot of different reasons. And you meet one family who's had to go through that. You've met one family who's had to go through that, right? Like it's always different for people.
It's always different.
Well, what I'm going to do first is just to get us get the ball rolling here. Tell us a little about you. Give us a little of your background. Give us your history. How did you end up here? And I'll have some questions for you along the way. So tell us about you a little bit.
All right. Thanks, Jerry. I always knew I wanted to be a nurse. So that was a pretty clear decision. I went to nursing school, and during the course of nursing school, we did several clinical rotations, right, in different departments of the hospital, and learned different things. And I became aware of hospice, and I knew when I had that experience that that's what I wanted to do. That's the area I wanted to get into. And in order to do that, because we're in the home of patients most often, you have to be pretty independent and well educated as far as experience to be able to identify when there's an issue or a problem or concern. So they would require a year of hospital or other nursing experience prior to coming to hospice. So
that gives you the opportunity to understand when it's probably appropriate for that kind of care to come into play.
It does. And how to recognize complications or things that need to be addressed, even in the home setting.
Okay.
Because we try really hard not to send our patients back to the hospital, right? The goal is to keep them at home, but we have to be able to identify what's happening and treat them in the home, keep them comfortable.
You're learning triage and side effects and signs of, certain failures.
Disease progression, and always trying to keep the patient and the family educated about what's next. What might you expect next?
Right.
And we try to be prepared and have what we're going to need in the home. So when the what's next happens, we're able to manage it, whether it's pain or shortness of breath or anxiety or, whatever symptom.
Right.
What's in your history, you've had to deal with it yourself too, haven't you?
I have.
Do you feel okay telling us a little about that?
Sure.
So people know it's personal for you.
Right. I talked to so many families over the years. I used to be an admission nurse for a period of time at Ohio's Hospice in Dayton early in my career, and I would meet with families. And they would say, I don't think we're ready. Or I don't want them to give up. So I don't think we're going to do hospice at this point. And I always talked about, what no one's ever ready for hospice, right? What's your concern, right? And you can sign up, and if it doesn't work for you, then you can always stop the service. Mm-hmm. Usually when someone signed up, they were grateful. I mean, the number one thing we hear back is, I wish I would have done this sooner. I was so afraid of it.
Mm-hmm.
Yeah.
About 21 years into my hospice career, my husband, who was 48, was becoming fatigued and taking daily naps. Definitely not like Les. He was a very active person. And so I said, okay, you need to go to the doctor. You need to get a chest x-ray and a colonoscopy. And if those are negative, I'll quit nagging you as your wife, right?
It must be hard to have a nurse as a wife. She's like, nope, not an artery. See, my mom was an EMT, so we had the opposite problem. She's like, nah, you're fine. That's not an artery. Go away.
That's right.
It's not bleeding.
I used to ask my kids, is there blood or fire?
Yeah.
There's not blood or fire.
You're going to school.
She's like, if it's not pumping out of your arm, get a Band-Aid, go away.
Okay.
Yeah. Yeah.
There were 7 of us, so.
Oh my goodness. No wonder she had to set some boundaries.
She was like, yeah, there's limits.
So it turned out to be something a little more serious.
It did. He was diagnosed with colon cancer. And at the time, colon cancer is pretty treatable if it's found early. And he had no family history. So we felt
there was no reason to really look.
Right. Yeah. And he wasn't of the age for screening, because up until just recently, this was 16 years ago, up until just recently, the screening guidelines were you start colonoscopies at 50. And he was 48. So,
50, isn't it?
Matter of fact, we had to push to get them to do the colonoscopy because he wasn't of screening age.
Yeah.
Anyway, he was diagnosed with colon cancer. We went home. He told our children. Our daughter was going to be graduating that June. This was in October. And I don't know why, but he looked at her and said, and don't worry, honey, I'll be there for your graduation. And we believed he would be, right?
Yeah.
Surgery 6 weeks later, go back to work and life goes on. But when they went in and did surgery a few days later, it was found to be widely metastatic and the prognosis was very poor. So he was in and out of the hospital 3 times, but mostly in the hospital over the next 2 months, including the holidays. Came home in early January, and it was clear he wasn't going to do well. And guess what? My friends from hospice started saying, it's time for hospice. And guess what I said?
No. Not ready for that.
I'm not ready for it. And
now
they're
you're
like,
on the other side of the fence.
right. All of a sudden,
now I understand why
I could
these
understand
people feel.
it. Yes. And I found that what came out of my mouth is, I don't want him to give up. But in reality, after reflecting on it, I realized it was that I didn't want him to think I was giving up.
Right.
Right. But he was very realistic, very open, and he said, let's do it.
And he'd heard you talk about these services for how long at that point? Like
Yeah,
he
21
got it,
years. He
right? He
got it.
understood.
Yeah, he did. So, and one of the beauties of hospice is we're available 24 hours a day. So, in the middle of the night, when your loved one's struggling and you don't know what to do and you're scared, because it is scary. Even for me, it was scary. When my husband would get up in the middle of the night, he was much taller than I was.
Not
and
the
just,
same thing when
you
it's
know,
your
yeah,
situation than when you're
yeah.
caring for someone else.
Right. And so we're there 24 hours a day in the sense that they can call us and we'll dispatch a nurse or chaplain or social worker, whatever's needed to go be with the family and handle the situation.
You had a few nights like that where you
We'll
ended
get
up
to that.
calling at
Yeah, because
2 in the
she
morning.
played a part in that whole thing. So I want to make sure we get to that at some point.
Yeah.
But so you decided to use the hospice services.
We did. We used hospice. And my husband happened to mention his promise to our daughter about being there for a graduation on June 3rd. And it was clear that wasn't going to happen. So in 2 days, they went to the Beaver Creek School District and orchestrated a graduation
ceremony.
And it was beautiful.
And go to our website and you'll see a picture. We're going to post a
Yes.
picture of that.
Yes. Dale Huffman did a great story about it. And it was on the front page of the paper. That was exactly 2 weeks before my husband died. But my daughter said when she went over in the picture, she's kissing him. And she said, I knew in that moment I was kissing my dad goodbye because I knew now he could die in peace, knowing he kept his promise to me and I could live my life.
You guys would be okay.
That, you know, she was able to fulfill that for both of them.
So from that aspect, I think one of the biggest issues, you rattled off a whole lot of pieces of this. So part of this is that it became very personal for you to have to use those services. And you know that the whole death thing, we're not getting out of it.
Absolutely.
You know, I got to make light of it because it's just true. Whatever gets us, something's going to get us. But if we have the ability to control that finality to some extent, because most people don't get to, you know, it just happens.
Right.
But if you have some way to control how that works,
and I love the concept of being able to get things in order and have, you know, closure to some unfinished business things.
It doesn't always work that way.
Things
but,
you don't get if there's a sudden illness or something like that.
And even sudden illnesses end up in hospice, right? And
sometimes people have a stroke or there's been a car accident
and they know
or a drug overdose and there's an anoxic brain injury.
They need that kind of care.
And they'll end up coming to hospice.
Okay.
Yeah.
So we're gonna back up. That's really helpful. And you have a children's story we're gonna talk about a little bit later too. That's in the second half of our discussion here. But what I think we really need to do, it's kind of like there was an episode where we talked about vaccines. And I think one of the interesting parts of that episode was that the doctor explained what a vaccine is and the difference between the kind of vaccine we're getting for things like COVID and something like your rubella and all those sorts of things. There's very different kind of formulations to those things. Well, I think people have the same problem with hospice. We don't really know what it is. We have misconceptions. There's TV soap opera hospice that we see where the person recovers and has an identical twin at the end of the thing. You know, what is it really? I mean, it's not hopeless. It's not giving up. That's not what the point is. Tell us what hospice really is.
Elizabeth, sorry, wrong person. Hang on a second.
Try again.
Come with the name.
Okay.
I'll come up with
We'll
the
figure
name
out the name.
Second.
Tune in next week when we hear Kim say.
I'll come back to it. The person who founded the hospice movement at St. Christopher's Hospice in England. What the heck's her name?
I will find it for you.
Dr.
Whenever you're supposed to have it in there, it just goes away.
It does.
You know, like in about 20 minutes, you're going to be like, oh, no, I know.
As soon as you say it, I'm going to go, oh my gosh. Because I talk about it all the time. There's this great quote.
Cicely Saunders?
Yep, Dame Cicely Saunders. So Dame Cicely Saunders is the founder of the hospice movement in the 70s over in England. She was a nurse and then became a social worker, then became a physician. And that's what taught her the whole person concept, right? Physical, emotional, spiritual being. And that we have to address all of that. And her famous quote is something to the effect of, hospice isn't just about dying. Hospice is about helping you to live until you die. And that's so true. We try to help families come together and say what they need to say. You know, we help to reconcile if that's what the family and the patient wants, right? We get the patient comfortable so they can enjoy time with their grandchildren. You know, I had a patient once who was an AIDS patient and she was very, very frail, about 80 pounds. She had 2 young children, 5 and 7. Wow. Her mom was her caregiver. The kids were kept in a back bedroom. And the room was so dark where she was at in the living room. The drapes were pulled and the TV was off. There was no music.
It sounds very 19th century, like
It was sad.
you're already in mourning for someone that's not gone
Right.
yet.
And so we began to work with the family and we talked about, do you have any picture albums? Let's bring the kids in and why don't you sit with the kids and talk about the pictures, right?
Mhm.
Before you knew it, I'd be showing up for a visit and the blinds were open and the kids are sitting in the chair with mom and they're laughing and looking at, photo albums, or they're reading a story together or watching a movie together. And it was just about helping those children to create memories, right? That they could have of their mom.
And it's not all scary.
It's not all scary. It's hard to acknowledge that someone you love dearly, who's so important in your life, is dying.
Mhm.
But like Jerry said, the reality is we're all going to die.
Yeah.
And if we can get out of our heads where we tend to fight it, right? We're looking for one more treatment, try harder. You got to eat more, take this medicine, it'll make you better. If we can just be present to the person we love and be with them and share that time, tell them what they've meant to you in your life. Talk about your favorite vacation memory. Talk about the funniest thing that you ever experienced with this person, because it validates for the person who's dying that they made a difference, that they've left a mark on the world as
Right.
well.
Well, I think it also helps people preserve their dignity at the end of life and have, some normalcy and to be who they are a little bit longer.
Mm-hmm. Absolutely. And, our patients, it's not uncommon that they have pain because they're lying in bed a lot. Even if they don't have cancer or something, they can still have pain just because they're not mobile, right? Or
Mhm.
they have anxiety or they have nausea or constipation or difficulty breathing. And we have medications and lots of other treatments we can use to manage that. One of the common misconceptions is that hospice uses morphine and it ends people's lives.
Mm.
So let me be clear, hospice does not do euthanasia.
As the caregiver, I'm going to tell you that is absolute nonsense. There could not be, that couldn't be more wrong.
Right.
I mean, there's just not, and I have people in my family that thought that.
Mm-hmm. It's a common misconception.
It's a common misconception, and that the idea is that you're taking them there to die.
Right.
You're not.
The reality is about 40% of our patients that come to the Dayton Hospice House on Wilmington Avenue go home.
Yeah.
They come in because they're having a symptom or they've got an infection.
And it's easier to treat if you have an inpatient facility like yours. Not all hospices do.
We're the only hospice in Dayton that has an inpatient
There's
facility.
5,500 hospices in the United States. The last statistic, it's probably different than that now.
And about 25 in hospice, believe it or not.
25.
But we're the only nonprofit hospice. We're the only hospice with a hospice house or inpatient unit. We actually have two, one in Middletown and one in Dayton.
Right.
So in every other case, they're coming to the person's
They're
home.
coming to the home.
Okay.
Right. And that's probably, I mean, as we've talked about, that's the best place to be.
If that's what the patient and
If
family
that's
want.
if that's the ability to do that, and you guys can provide the care to make that happen, then that's always the best thing for the family. But what's the best thing, and this kind of goes into more about what hospice does. Sometimes what the best thing for the family is not the best thing for the patient.
Mhm.
So that's when it's time to come in. If there's a facility, and a lot of hospices use nursing care facilities as their in-house places, right? That happens
If they
too.
don't have a
They
hospice
partner
house,
up with
they-
a nursing care facility, a standard nursing care facility, not a hospice, but they'll use a space specifically for that purpose.
So
Absolutely.
it's more of a rehabilitation center setting.
Yeah, it's like it's a regular nursing home. It's just that they're using the bed for this purpose rather than
And the nursing home staff are providing the care.
Yes.
Right.
Not the hospice staff. I mean, the hospice staff
they're
usually
overseeing
visit
everything
daily,
and
but-
taking care of whatever you need from that aspect. But when you get into end of life care, then the hospice staff takes over probably, right? Or has some more control over that, or they already know what to do.
Well, and
They're providing the instruction.
they make a daily visit usually, making
Okay.
sure the patient's comfortable and working with the nursing home team, definitely. But day to day, hour to hour, the care is provided by the nursing home staff.
Okay.
Yeah.
And you have to, that's case by case, right? You got to
Right.
know where you're going and why they do it. And so you have to talk to your
Yeah.
particular hospice and find out how they handle that sort of thing.
Absolutely.
So that brings me back to the other part of this thing. There's a word that is very thrown around a lot, very often, that people don't know the meaning of: palliative care.
Mhm.
Tell us what that means.
So palliative care is similar to hospice care with one significant difference. Hospice, by Medicare regulation, the patient has to have a life expectancy of 6 months or less, given the normal disease course. So if you had heart disease or certain criteria, I'd look at to see if you have meet those criteria, and then you would be eligible, and a physician, or actually two physicians, would sign off that you're eligible. For palliative care, you do not need to have a terminal diagnosis with 6 months or less.
Okay.
So it's somebody who has a chronic illness, heart disease, lung disease, cancer, kidney disease, but they're seeking active treatment, most likely still, maybe taking chemotherapy or having an LVAD or, on dobutamine drips, those kind of things for heart disease. So they need symptom management. They get the nurse, they get the social worker, they get the chaplain, they get the physician. We have a psychiatrist on our team, an exercise physiologist.
But they're not at the end yet.
They're not a
this is a whole
6-month
different
prognosis.
right.
So think of it this way. All hospice is palliative care,
Okay.
but all palliative care isn't hospice.
What does palliative mean? What is the word?
That's what I was
Comfort,
saying. It
comfort
means
oriented.
to
Comfort
keep
oriented.
someone comfortable and
But you're
to
still
alleviate pain, right?
But you haven't removed, and it's not. It does not always mean that you've removed the what kind of treatment would you call that? The medical treatment, so
Right.
to speak. They're still
Right.
doing those things.
They can still be doing those things.
Right.
But at that 6-month prognosis, that's going to be a variant. That's not going to. It's not always going to. Some things you do and some things you don't. But it's all palliative care. It's comfort care. And
Right. Hospice is comfort care. Palliative care is comfort care. The main difference is hospice is for the last 6 months or less.
Okay.
And palliative care is more upstream, if you will, sooner in the disease process.
Okay.
Oh, I'm sorry. I thought you were going to ask a question.
No, I was just agreeing that made sense.
Okay. Well, good to know.
I understand it
I'm
now.
glad you know that.
Okay, I get it.
And I, I should point out, I as we said at the beginning of this thing, I had to learn this stuff as we went. I like to think that I tend to do a lot of research and know what I'm getting into before I get into it. But when you're sitting in the middle of it, your logic goes out the window.
It can.
Because you're stuck trying to figure out what to do for this person that you're caring for. It could be a parent, could be a child, could be anything. And if you're the person making the decision, or you have a committee in your family, the brothers, sisters, whoever, it's hard and it's almost impossible. And as soon as they hear that word, it's like, nope, the brakes go on. And it's just, I want them to go back to the hospital. But then you realize that there are certain aspects of the family member being in a certain position. For example, my mother, when she got to be that point, was so frail. If her heart had stopped or something like that, if they had gone to the typical resuscitation measures, that would have killed her. Just the pressures of things like the shocking or the CPR compressions.
Yeah, she was so tiny.
There's no way she would have survived that. And that would have been an awful thing to put her through, because the quality of life after something like that, and that's what people are thinking about. You're going to keep them alive.
When you think about the TV things, right?
The TV things are nonsense.
They always survive CPR.
They always survive. No broken ribs, no nothing. Your sternum almost always breaks, doesn't it?
It does.
From the severe stuff.
If you're doing it correctly, if you're doing
you're going to
CPR
break that bone, and you never hear that unless they're trying to set the doctor on.
Later.
Well, the ER doc, on TV has got to have a dramatic thing where he's about to get kicked out of the hospital, and this is the straw, right?
Yeah.
So
Jerry has a problem with House. He feels like he would have been fired so many times.
House was an idiot.
Like
Here's a guy who could.
Alone.
This is a guy who couldn't. Imagine House in a hospital situation for real.
No way. Nobody would have insure him.
This guy could not figure it out. Makes all the mistakes for the first 47 minutes of the show.
Yeah.
Gets it wrong, like
almost
completely.
Kills the patient like
almost
4
kills the
times.
patient. Blames the residents, which is my favorite thing. He's got interns. He's blaming them, and then at the end he comes across with the right answer because he stole it from somebody else. The show's terrible. It's just so bad.
Well, then there's Chicago Med. No, that's a
Don't
pretty
even.
good one.
I haven't seen that one, so
I don't. I gotta be quiet because I work on an NBC station sometimes, so I gotta be nice.
Since when are you quiet about anything?
Well, I'm gonna be nice. So let's see. We're moving on to other areas of this. So I think it's important, as we're talking about this, the thing that I really wanted to do right up front was to explain what hospice does. And I think what is the difference between the types of care that someone in an in-house facility gets versus someone that's getting home care from a hospice? What's the difference there?
So hospice can provide care to patients in their own home or in a nursing home or assisted living. So wherever they call home. Okay. So when someone's on what's called routine home care, and that's about 90% of our patients, our nurse is visiting based on the patient need 1 to 2 times a week. When they're declining, maybe daily. It depends on what the needs are.
And then there's other support care that they do too. They have bathing. We have other
nurses' aides who will come out. We call them patient care specialists. Who'll come out and bathe the patient and just be with them, help with their hair and that sort of thing. We have social workers who will help with resources. They can help with funeral planning, and they can just help the family and the patient work through their grief, right? Because the anticipatory grief that happens, as you know.
Oh, we're going to talk
when
about
someone's-
anticipatory. I've got it
Yes.
circled here. We're going to go over that one.
Okay.
That's kind of a
And-
mouthful, anticipatory grief. That's
Yeah.
hard to say.
And then we have our chaplain to address spiritual needs, of course, and we have volunteers and bereavement counselors. So there's a whole team of people that are available to the patient and family. There's different levels of care. So routine's the most common.
Mm-hmm.
We have respite care, which is up to 5 days where they can come into a nursing home bed or the hospice house and give the caregiver a break. Nothing's really going on with
Gives
the patient.
the family a rest.
It just gives the family a break.
And we're assuming the patient is sort of stable, or at least enough to maintain without the family having to be all worried and excited about something.
Right. Sometimes, conditions can change during the course of respite,
sure,
and we'll
yeah.
make them inpatient. But yes, it's normally more like a custodial care situation. The family is exhausted, or the family member becomes ill, and someone needs to provide care for 5 days.
Mm-hmm.
Then we have what we call our 2 higher or highest levels of care, and that's continuous or crisis care or inpatient care. And I always explained it to the patient and family like they come to the T in the road, right? There's acute symptoms that need managed, and we can either bring the care to the patient in their home, again, nursing home, home setting, or assisted living, up to 24 hours a day at the bedside to provide that care, or we can take the patient to the care, and that's the hospice house.
Okay. And that's you have how many beds there?
We have 53 beds in Dayton and 13 beds in Middletown.
Okay.
And there's hospice staff, hospice nurses, social workers, chaplains, and PCSs providing the round-the-clock care in the hospice house setting.
So we talked a moment ago, you mentioned the word anticipatory grief. I think that's a huge piece of the problem for family members and caregivers about knowing that this is coming and you're starting to grieve before the person has died.
Right.
That, to me, that's what it lands on. And we
Absolutely.
did our 12th episode of the second season. We did a whole thing on grief, and it was all about, one of the things I was talking about was even before my mom passed away, I had made my peace with it.
Mm-hmm.
So by the time we got there, believe it or not, I say this with, all humility and not really sure of myself, but I feel like I was ready for it because I had prepared myself, and my cousin who helped to take care of, did the majority of the care with my mom at home. I helped her, wasn't the other way around. That she had that experience multiple times at that point and worked in a nursing facility and kind of helped me to wrap my head around it.
Mhm.
She helped you with the psychological journey.
She
of
did.
it.
And it was just as hard for both of us, but it was easier to understand from a logical standpoint because you know where it's going. You can't avoid it.
Mhm.
There's going to be stages that we see in her decline. She had Alzheimer's, and there were all these different things that were going on. But she also had a heart defect and other things that were affecting her health overall. But it wasn't like that when I got to my dad.
But she was sort of your social worker in that situation then.
Well, kind of, but then we needed help too, the both of us, because we didn't want to, we fought tooth and nail to hold on to her and try to help her be healthy. But at the same time, we were also trying to keep the difficulties away from my dad. We were trying to make sure he had just time with her. He didn't have to he wouldn't have known how to do any of this stuff in the first place. My mom was the caregiver in our family. She's the one who sat across the hospital bed from me and did all that stuff. I mean, that was her thing.
Yeah.
So
She was the nurturing.
she was the one that did all that. So it was hard but with Dad, it was a very different thing because for one thing, his mind was still there. He never had any sort of dementia or anything. So he knew what was happening to him, and he didn't really understand it. And we'd had the conversation, but that made it even harder. So the anticipatory grief of this was more dangerous to me as we got closer because my brain would not accept what I was seeing. His decline happened so fast. It was the basis of it was going very slowly, but then we came up to the last few weeks and it just crashed.
I remember that.
Everything was falling, and you had to get involved in there and help me out with some of that. And it was just like, and your staff did a beautiful job, and we'll talk
And
about
it's
that
more
in a bit.
difficult for the caregivers psychologically because you know that person knows what's going on and can't do anything about it. And it leads to more stress between the two of you because he was still at a point where he could argue with you and
Oh, we were arguing all the time. It was so hard. And that's the thing I would have changed if I could have just said, okay, and just not fought back. But I'm trying to get him to do or behave a certain way because we needed him to. And he's not that person. He was a very strong-willed, it's my way or nothing.
Well,
Jerry,
there's also a point of pride where I think he didn't want to be a burden.
Well, yeah, that was definite there.
It's hard for people who are alert and oriented because they know they're a burden, right?
Yeah.
They feel like they're a burden. So yeah, that's a difficult challenge. We always say that people die like they live, right? So if somebody was strong-willed their entire life, you're going to see that. Maybe even it's going to be accentuated as they enter into the final months of their life.
Oh
right?
gosh, I hesitate to see what you're going to be like.
I'm going to drop dead at my desk. You've already figured that out. We're going to take a break
Let's
here
hope
in a minute.
because I don't want to argue with you.
We're going to take a break, and we'll be back in just a minute with Kim Vesey from Ohio's Hospice of Dayton. See you shortly.
Thanks for watching the Old Nerd in the Gym Fitness Podcast with our hosts, Julie Barth and Jerry Deere. If you are involved in caregiving, fitness, health, and wellness, and would like to be a guest on our show to tackle one of our important topics, please reach out to us at oldnerdinthegym.com or email oldnerdfitness@gmail.com. And now back to our show.
We're back with the Old Nerd in the Gym Fitness Podcast, Julie Barth and myself. And our guest today, again, is Kim Vesey from Ohio's Hospice of Dayton and What Cloud Grief Resources. We're going to talk about that in a couple of minutes. But we've had some pretty heavy topics up till now. Let's lighten this up a minute. So we've got some fun questions for you. Are you ready for this?
Probably not, but go ahead.
Do the whole.
Everybody's always so nervous about the fun.
They're always so nervous about the fun
what
questions.
could we possibly ask you that's horrible?
How many rutabagas will fit in a watermelon?
How much wood? What a woodchuck?
Woodchucks don't. That's a beaver.
That's right.
Don't ask a farm kid about
It's
woodchucks.
Dayton, Beaver Creek.
It's Beaver Creek. What's on your nightstand?
My
Night table, whatever you refer to it.
Little tablet, because I like to read romance mysteries.
Oh dear.
And so that's what I do to go to sleep. I don't do any work stuff. Once I'm in bed, I'm reading
That's it, huh?
I'm reading my little romance thing. Yes.
That's good.
Okay.
Yes.
Let's see. Did you have a favorite kid show or cartoon growing up?
I love Scooby-Doo.
The old Scooby-Doo.
Old Scooby-Doo.
Old Scooby-Doo. 60s Scooby-Doo.
Where are you?
That one.
Yes, with the little van. And
It was always
The
Farmer
Mystery
Brown.
Machine. Farmer Brown.
See, I like mysteries even back then.
It's a
See?
different kind of mysteries.
My mom
Yes.
reads dog mysteries. I don't even know why. That's
I'm
a
sorry,
separate
what?
genre. Dog mysteries.
Dog mysteries? Is it
It's
like
a
Benji?
fire dog that helps. I haven't read them. I just see them.
think they call that Lassie.
I just see them on our library card.
Is Timmy still in the well, Lassie?
Why are the gnomes on Lassie now?
Well, because she's got to be. They don't understand her. That's all things are going wrong.
My goodness.
So you deal with some pretty heavy stuff day in and day out. What do you do besides the mystery novels? What do you do to get out, to keep yourself active and do all this kind of? What kind of fun things do you like to do? Roller coasters.
Oh, not a roller
Going
coaster
over the
person.
falls on a barrel. I mean,
For some reason, I thought you were going to say rollerblading. I don't know. why.
rollerblading.
She
What,
started
is that
saying
still
roller.
a thing with the rollerblading?
I don't know.
I don't know.
Ice skating.
I've gone ziplining before. I was
Really?
in Alaska. That was pretty.
Oh,
risky
hold
for me.
on.
That would be fun. Alaska.
Alaska?
Oh, that's unusual.
What were you ziplining over? Eskimos and
Mountain
like sea
bike.
lions or
Pretty
something?
much.
I'm going to call down the
From
fact there's
one
no sea
iceberg
lions.
to
and
another.
one iceberg to Is that what you think Alaska is?
Yes, it's all iceberg. Polar
Private
bears
school
and
education.
penguins.
Anyway,
Polar bears and penguins.
polar bears and penguins.
Can't say
think
I
they
saw
have
any of
either.
those. I didn't see any of those.
They don't
either.
have either of those.
They have bears.
They have
and-
regular bears. They have
Yes.
ordinary bears. They're not big white bears.
I imagine the bears don't feel like they're ordinary inside themselves. They
So-
probably feel special. They have good bear
Oh
self-esteem.
my gosh.
They have the bear essentials of self-esteem.
You gotta put the trombone slide in that one
I'll
for
do it
you.
for myself. Too.
All right.
Sure.
But I like to walk and just
Yeah.
enjoy sunsets. I mean, one thing that being a hospice nurse this long has taught me is
Makes you
just
appreciate some
to live
things.
in the moment and notice
Definitely.
things. Maybe it's flowers, maybe it's the sunset, maybe it's watching a deer just graze. Spending time with my son Patrick and my grandson Warren, just precious. And I get focused on those things because, well, after losing my husband at 49 and my daughter at 29, and it taught me that life is short and you never know.
You only get the one.
Mhm.
With that, here's probably the most important question. What's on your pizza?
Double pepperoni, well done.
Oh.
Wow.
And if I'm going to splurge, I'll add a little bit of sausage.
Oh, 2 meats.
See?
That shouldn't be done.
There's nothing wrong with
But
two
here's the
meats.
big question. Are you ever pro pineapple on a pizza?
Can't say that I am.
Excellent.
Yay.
We're up to 85%. Between the two podcasts, it's got to be 90.
We'll round up, right?
I think it's awful. I think
We have our own anti-pineapple scheme.
we have an anti-pineapple
I think we need anti-pineapple t-shirts.
Anti-pineapple, old nerd and the anti-pineapple. We should do that the whole episode of that.
We cannot form a whole episode around anti-pineapple. It's
Well,
like 1 minute. We're anti-pineapple.
the
That's
dull
end of your
people will be
episode.
outside the studio protesting. We'll
That's right.
Yes.
carrying around pineapples.
I'm sure all the executives at Dole are listening to our podcast.
Well, no, I wouldn't mind
No, they
a
are.
serving of pineapple on the
pineapple
side.
by itself is
Yes.
fine, but
As
it
in,
should
like,
never be
dessert.
on a pizza.
No,
I
hot
just
pineapple.
cooking
Ugh.
pineapple. Like my mom used to put it on a ham, you know,
Yeah.
with the cherry in the middle.
So that doesn't bother me.
But she never ate the
But I
thing.
don't
She
eat
threw
it.
it
You just
away.
take
Take it
for
and leave it
looks.
in the juice so it tastes like pineapple.
Well, yeah, it gives you like some sort
It's
of flavor
supposed to
too,
be
right?
pretty, yeah.
But it's pretty.
And you put a cherry in the middle.
But does it? I mean, is it supposed to be Hawaiian or something? I mean,
no, the
'cause it's
acidity
ham?
is good with the richness of the ham. And when you add a little acidity,
Sweetness, yeah.
it counteracts the saltiness of the ham.
okay. Just to be
Mhm.
clear, the most cooking I do is pouring hot water into a ramen cup.
You
so
made pizza once. I helped you.
you did help me make pizza, but who did most of the work?
I just let you put toppings on. There wasn't really, I mean, it wasn't a lot to do.
I don't eat. Yeah.
Put toppings on and put it in the oven. Pizza's pretty simple.
Okay. So we're gonna spin this back around. So I want to talk about your book and your other things that are going on. So you're not in when the hospice H signal is not flashing in the sky for you to get in the hospice mobile and go and save people. What you're writing this book? Is it more than one?
There's more than one.
There's more than one. Okay, tell us about What Cloud Is My Mommy In
So
and how that got going.
my daughter was 28 years old when and her best friend Jessica used to babysit for my grandson, Sarah's son Warren, and unfortunately Jessica's 16-year-old son was shot and killed. And so when my daughter was explaining to Warren that Ronnie was in heaven with Pop, her dad now, he simply said at 3, "Where's heaven?" And she said, "It's in the clouds." And she told me about that conversation. And sometimes by the grace of God, I remembered that, right? Because sometimes you don't always hear
It doesn't-
everything, right? It
Doesn't stick. Yeah.
Right.
So 9 months later, Sarah has a severe asthma attack in the presence of myself and Warren. We do everything we normally do. She gets in the squad, but goes into cardiac arrest en route to the hospital.
Oh my.
They do resuscitate her, but we learned about a week later that they weren't able to intubate her. So she had an anoxic brain injury, lack of oxygen to her brain, and she was not going to regain consciousness. So she was in the intensive
Wow.
care unit for about 3 weeks, and she died on the ventilator from sepsis, is a complication. So,
And sepsis is a blood infection.
right.
Mhm.
So, about 2 weeks later, I was watching my grandson. He was 3.5 at the time, and we're out walking my dog and looking up into the sky. And he goes, "Mama, what cloud is my mommy in?" And I knew why he was asking because Sarah
Thank goodness
had
you had
said,
that frame of reference, or you'd have been like,
what are you thinking? And I
"What are you
said,
talking about, child?"
and I just said, "Warren, honey, I don't know which one she's in, but whatever one she's in, she can see you every moment for the rest of your life."
Mhm.
And so about 18 months later, after watching him struggle and watching the people who loved him dearly and were trying to protect him as best they could, not want to talk about Sarah because they
Mhm.
didn't want to make him sad. The reality, I mean, I know grief because
you
of my
need to
work.
talk about it.
You've got to talk about it.
Yeah.
And
Yeah.
especially when death happens, involving a loved one for a small child.
Mhm.
Because if they don't process that grief effectively and well, it can affect how they respond to all future losses in their life. It
Mhm.
really is a significant factor in,
Yeah.
in their development. So I decided to create a book about mommy loss, right? So the title of the book is What Clouds My Mommy In? And the book takes you through the whole first year of grief. So it introduces the child playing with the mommy, and then the mommy gets sick and goes to the hospital. Mommy dies. And then it takes them through Thanksgiving and Christmas and Easter and Valentine's Day and Mother's Day and the mom's birthday and the child's birthday. It helps them to know what they can do as
Mhm.
far as honoring and creating tangible remembrances of them, of the mother. But it also, throughout the story, teaches them that it's okay to be sad, it's okay to cry, but it's also okay to laugh and be happy, because all those feelings are part of grief. And that we just talk about the variability of feelings. It's normal, and things that they can do to remember their mom. It's also a guide for parents. So, for example, encouraging parents to create a journal while the child can remember things, right? The surviving parent or grandparent. What did you love to cook with mommy? What was your favorite activity? What book did you read together at night? So you can capture those things, because a child won't remember those later in life.
Your niece did something which I really liked at your father's service, where she gave out the bears.
Yes.
So that the smaller children got a bear, and whenever they missed Grandpa,
They had
could
something to
hug that
associate
specific
with.
bear.
That's
really
an awesome
sweet.
idea. Yes. And this bracelet that says peace, my daughter was all about, being peaceful and helping others. So we gave these away at the funeral. And a lot of people I still see wear these, and it's always a reminder that they're wearing it in honor of Sarah.
So how many books did you end up writing then? They're all grief related, right?
They're all
The
grief
ideas?
related. So there's What Clouds My Mommy In, and then What Clouds My Daddy In, What Clouds My Grandma In, and What Clouds My Grandpa In. Those 4.
Are they all here?
Yes.
Okay,
Those
I'm gonna
4
hold these up to the camera. Can
Okay.
the camera see this?
are pretty
I think
much
they can.
identical. Okay. So
There it is.
all 4 of those take the child and the parents or grandparents, upside down, sorry, through that whole first year of grief. Now, I've just sent off to the publisher the brother and sister version. Sarah's pulmonologist had said to me they really need one about sibling loss, and he's at Dayton Children's Hospital. So I've written a book about What Clouds My Sister In and What Clouds My Brother In. And those books are totally different than these. They're about 3 turtles who go to grief camp, and they meet at grief camp. And one of the turtles lost his sister at birth. So he doesn't have memory. So that really ties into the perinatal loss, stillborn, like term miscarriage, for those kind of losses. But then there's a teenage turtle who lost his sister and a younger turtle who lost her sister. And they go through these activities together. And ultimately, they learn that talking about their sister isn't just sad, but it helps you to get in touch with the feelings that are good feelings too, and the love. And at the end of the story, basically, they acknowledge that their sisters took part of their heart with them when they left, but left part of their heart. So their hearts are whole, and all they have to do is put their hands on their heart and feel that warmth and that heart beating, and that's love being sent and received. So those are coming out. And the last one that I'm writing, I think, is What Cloud Is My Pet In. I've had a lot of people ask. So instead of doing individual pets like dogs or cats, it's just going to be about
in general.
One pet. Yeah, that makes sense.
So I'm writing that one now. And we have a local.
You could call it What Cloud Is Fluffy In.
There you go.
Because they're all named Fluffy.
Yeah,
that's
true.
turtle named
At
Fluffy.
one point, we had a Fluffy, Ruffy, and a Scruffy. 2 cats and a dog.
Oh my goodness.
My 2 cats and a dog, and it was Fluffy, Ruffy, and Scruffy. Scruffy was the first one to pass away. Got hit by a car.
Well, that's
and then
tragic.
I had my cat. The dog was 14 years, and the cat was 19. So Scruffy didn't make it much at all longer. The other 2 were much later in life.
Wow.
That's depressing. So.
Well,
there were 7 of us. We had a lot of pets go, like hamsters and stuff. I mean, I can't even
There's
count.
a whole cemetery in the backyard.
Can't even count how many hamsters we lost over the years.
Yeah. I would like to acknowledge, though, that Amy Gand is a local artist and owns Lulabelle Art and Design in Oakwood. And she's the illustrator for all the books. And she really brought the books to life. Her art's very whimsical, and that's what I wanted. I wanted it to be
cute.
bright and light-hearted and not
be
be scary for children.
And it's got to be that way. And I noticed they're kind of watercolory too. It looks like a kid would have done it in some fashion.
And they're kind of soft. And
every page has some symbols in it because, a lot of times people talk about butterflies, ladybugs, and cardinals as representing, that someone's died, and that's kind of an image coming back. So every page just about has that in it. And you can look for those things on each page.
I had not heard the cardinal thing. I had heard the butterfly.
Yeah, the cardinal thing's around here mostly. You don't hear that much out of Ohio, strangely enough.
Good, since we have a lot of cardinals.
We have a lot of cardinals.
It's a state bird, too.
It is. It's a state bird. So what we'll have, if you're listening to this or watching the video here, you can go to oldnerdfitness.com and we'll have links to everything where you can buy all the books and you'll know. Now, one of them got an award.
Yes.
What was the award?
The What Cloud Is My Mommy In won the Christian Indie Award for children's books for ages 4 to 8.
Nice.
So that was a huge honor.
That's
Absolutely.
a big deal. And
it is. And the other thing that's available, I didn't bring it with me, but I have little turtles that are knitted.
Oh.
And
That go
so
with the
with the
turtle
book,
that's on the
and so
front.
so they can hold it and use it as a touchstone. So kids can put
That's
them in their
nice.
pocket, go to school with them. If they're missing mommy or something, put their hand in. Nobody needs to know what they're touching, but
Right.
it's just a way to stay connected. And those have been a big hit with kids. So and all of my proceeds to date, any proceeds that I've made have been donated at year end to organizations, nonprofit organizations that support grieving children.
That's great.
So December 31st, I donated to the National Alliance for Grieving Children. It's a national one. And then Oak Tree Corner here in Dayton. And also to Hospice of Miami County for their grief camp specifically for kids.
That's amazing.
Nice.
Wish I'd known about some of those things. My sister passed away when my son was 10, and I didn't know any of those
had
things.
a hard time.
Didn't know
with
any of
that.
those things existed at the time.
And it was, I think the thing that we run into the most now, we're just kind of spin it back to the hospice conversation, is that we talk about, funerals aren't for the person who passed away.
Absolutely.
They're for us. They're for the survivors.
Mm-hmm.
Hospice does a similar thing where I got to say, as much care as my parents got, you did as much to take care of us too.
Mm-hmm.
One of the things that really stands out about that is when we were in that last couple of weeks with Dad, and it was just a few days before you and I spoke.
Mm-hmm.
And by that time I was a mess, but the few days before that, there was one particular night. It was the night after that photo that I showed you, and I'll post that photo on this particular page so people can see it if they want to go look at this episode. But he was pretty bad, and I was losing it, and he wouldn't rest. He was very restless. He had that, we were coming down to the wire, agitation, and we didn't know a lot of that was pain driven, because that's what a lot of the agitation is, and at least for him it was. And the nurse that came that evening, we had two. One came earlier in the day, helped me out with something, and I think this young lady came later on. And I remember we got him settled, and she, no kidding, grabbed me by the arm and dragged me to the living room and put me in a chair and said, "You're not going to move. You're going to stay right here for a little while." And went back, I'll take care of him. You just sit right here. And we were already considering a respite, because I didn't have any options. I was starting to just go.
Well,
and
at that point, you hadn't slept in 2 days at least.
It was quite a while. It was rough. And one of my bigger things was I wanted you guys to see him firsthand, like for a longer period of time, and see what am I, because
you're dealing
I
with.
knew what I was seeing, but it wasn't registering. It was like this, I've been working too hard at this. There's got to be something else we can do. And there's just like, and we were already at the course of medication where anything beyond that would have just been too much.
That's what I was talking about earlier too, Jerry. You were in your head.
Oh yeah.
What can we do? What can we do? What can we do?
How do we
Instead
fix
of
this?
just being present to the moment.
And
right?
we couldn't really. And because you're trying to solve his problem.
Right.
My thing was to try to get him to be comfortable. I mean, that's he was just in so much pain, and the agitation was kicked up so much he couldn't even lay still.
And that was the perfect time to call us and say, "I need you to come out," right?
And they had been coming.
Right. But I mean, that's exactly what hospice is for those moments when you don't know what to do.
And putting him in a hospital would not have helped.
No.
They would have sedated him or something.
Room.
No, that wouldn't have done anything.
Well, and if you went to the emergency room, he would have went with him, and he wouldn't have got any rest.
It would have been the same problem, and he would have gotten worse. Honestly, he would have just been, and without any of the kind of care that we're talking about, he would have just gotten worse, and they would have been trying to solve the pain problem, because that's what they're supposed to do.
Right.
It's their job. So,
do you think there's a point where people are just grasping for something to do because they need something to do to take their mind off the other things? Like, my mom tends to research like excessively sometimes when she's stressed.
Overthinking it.
What's the latest drug? What's the latest treatment?
What can we do for this?
What might this be?
Yes. And I find that happens a lot.
At what point do you... Okay, we talked about this a little bit, but I want to circle back around to this. But I remember when we were dealing with Dad, he was still at his house. I hadn't moved him in with me yet. But I thought that some of the services hospice could provide would really help him. Or it was, I don't remember when this was, but so I contacted you guys and they sent somebody out. And I knew this lady, I can't remember her name now, but I knew her from dealing with my mom. So she recognized me, and she had been there before. She remembered the place because it's pretty distinctive.
Yeah.
So she came in, we chatted a little bit, and we decided to go ahead and give it a try. And the more I thought about it and what we were going to get versus what he needed, versus what was being done, it wasn't the right time. It actually wasn't. It wasn't me putting a brake on it and saying, I'm not ready. I was clearly ready for it.
Right.
But the thing was, it wasn't right yet. And my thinking was, I'm pulling resources away from somebody else who really probably is there. And we don't need that yet. And after we got it going, I realized that wasn't going to work. So I went back to the lady and we discussed it and she agreed with me. I gave her my reasons and so we stopped it with the, I'll call you later because it's coming.
Right.
It just wasn't there yet.
And how long was this before?
Before we actually needed it?
Yeah.
3 or 4 months, I think.
No, it was almost a year.
Was it that long?
Yeah, it was easily a year before we actually took him into my house.
So that was the right decision.
So yeah, it was the right thing. He wasn't there yet. He was still pretty active and mobile. He was still declining, and by your standards, he was in that declining state. But it was so slow that it was various things. You know, I like one of the things we were talking about not long ago, and in fact, I just gave us a presentation on this to one of the local service clubs. When people think about Parkinson's, all they think is about the shaking, the tremors. Your nervous system is shutting down and it's shorting out. It's and there were a lot of, you know, older guys in the room that I gave this to, and you could tell they were car guys. They knew about electrical systems and stuff like that. I'm like, imagine you took all the wiring harness out of your car and laid it on the ground and took an axe and just chopped in the middle. How would it work then? That's what Parkinson's does to your brain. It just shreds how your nerves respond, and it does whatever it wants.
Destroys the communication system.
Yeah, the communication's gone. The impulses are gone. That's where some of the pain comes from that you can't tell where it's coming from. There's no way to give somebody an antidote for something when you don't know the problem. So he's breaking down on the inside with this. Nobody can fix this. And it took a certain level before I was able to go, all right, the aide that we had that came a couple of hours a day, they were there to help with lunch and things like change his clothes so it gave me a break and it gave them, you know, him time to not have to listen to me yelling at him.
And it's nice for the patient too,
to get away from me. People. Yeah, I was terrible.
Yeah, he enjoyed the social interaction.
And if I needed him to do something, I was not the person he was listening to. I'm the baby of the family. I mean, people don't think about the fact that when you're dealing with your parents, I heard all the time, well, it's like taking care of your kids. No, it's not. Your kids have no dignity. They'll do what you tell them to do. Your parents,
well, hopefully they have some dignity.
Well,
but yeah.
They don't get dignity yet. I tell you to go to bed. You go to bed.
Come up with consequences for children.
Right. What am I supposed to do with dad?
Take your dad's PlayStation away.
But there is
I mean, it doesn't work.
But there is a dignity level there that you have to adjust to a parent,
and respect
to an adult, that you don't need to do with a child. It's the child needs to obey what you tell them to do because it's in their best interest. Dad has all the best interests in his own head. I don't know what I'm talking about. So what I would do.
There's also the part in your family that you're all used to being told what to do by women.
Well, that's true. But the other, what was easier is if I could give the nurse, I would give the hospice nurse, or I would give the aide, tell him I need to do this. Tell him to do that, or however you do it. I need him to do this thing.
Yeah.
And if anybody else told him, not a problem. It was done. That was no big deal.
It works the same way with my 16-year-old. 15-year-old. As long as it's not for me, he'll do it.
Well, yeah, and that's kind of what you're dealing with too. But I guess where I was going with this, how do you know when it is time? Because sometimes doctors are reluctant to bring that up.
Well, I think often doctors are reluctant to bring it up because, you know, their purpose is to cure.
They feel like a failure too at that point,
so
right?
they feel like they're failing, and they feel like they're failing the patient and you as the family. And they know you don't want to hear what they're going to have to say.
Right.
So, I mean, there's some things that are universal that we look for, right? So has the person been losing weight? Usually, if you have a chronic illness and you're getting to the final stages, and again, when we say final stage, we're talking 6 months, not weeks, not days, right? Almost half of our patients die in less than 7 days. And that is what causes people, I believe, to think that the hospice is about dying, right? People are waiting too late, and we can't do what we do as well in 7 days.
Right.
You don't get to know the staff. You don't get to use the respite and the other services we have. We can hardly get their symptoms managed, you know, in that amount of time. So really, we're looking at like a 6-month prognosis. So you have a chronic or terminal illness. Weight loss is something we look at. Changes in cognitive functions. So maybe sleeping more, having some confusion that's new, right? Changes in physical ability. Are they able to get up? Are they able to walk to the bathroom? Are they continent of their urine? Those kinds of things. We look for, have they had recent infections? Again, sometimes when people are getting weaker because of their disease process, they're choking and they're aspirating, they'll get pneumonia or a respiratory infection.
That's probably one of the most common things, isn't it?
Yeah, urinary tract infections. We look at that. We look at, have they had recent trips to the ER? Are they having more symptoms, right? And have they recently signed a do not resuscitate order? Right? Have they recently made the decision, I don't want to go back to the hospital? Those are the things that begin to tell us that they're kind of getting ready for this and we can help them. The one thing that I want to make sure I mention is that you do not have to have a do not resuscitate order to be on hospice. And people think that's crazy. But, sometimes when people come on 6 months before the end of their life,
they're not ready to go yet.
Yeah, and their quality of life
could still be maintained, right?
And so, I want to be resuscitated, but we work with them as their condition declines. And before they get to the point where their heart does stop beating or they stop breathing, probably 98% of the patients say, you know what, I'm weary. I don't want to keep going. I'm signing the DNR. For the small number of patients who continue to want aggressive treatment,
there it is.
Go for it. They sign off hospice and they go into the emergency room and get admitted. They can be in the ICU on a vent, whatever. They always have that option.
And there's more than one level of DNR, right? You don't have to say all or nothing. There's something in between.
There's two
levels, yes.
There's
where
two.
There's some help and some.
One is comfort care only. One is comfort care with a heart resuscitation.
Okay.
Which is comfort care arrest. And it's actually, you go up to the actual point of their heart stopping.
Okay.
And that's when you stop treatment.
Gotcha.
So comfort care is just, we're not going to do anything aggressive. We'll continue to give you medication for pain and keep you comfortable, oxygen if that's needed.
Right.
Comfort care arrest is, you're starting to decline. They're going to use drugs to push drugs to help get your heart rate pumping better, your blood pressure up.
Okay.
They may use more oxygen. They might use BiPAP. They could even use a ventilator, right? You could be intubated. But once your heart stops or your breathing stops, treatment stops.
That's it.
Yeah. So it's kind of like an intermediate kind of.
Yeah, I figured there was more than one level.
Yeah.
That's taking into
Just
account
two.
there could be a rally there at some way
Right.
with the heart. If you're still breathing, your heart's still going, then there could be a turnaround to some extent. That's the purpose of that. I think if there was one thing you wanted to clear up about hospice that people really don't get, like the biggest thing, maybe we've covered it, I don't know, but is there something that sticks in your mind that you run into an awful lot that people really should hear? Like point blank, here's what it is you people are just not getting. What would we say to them?
Hospice is an incredible service that provides so much relief for the patient, comfort-wise, addressing emotional and spiritual issues, and for the family. I mean, the unit of care is the patient and the family. So we do, we help the family with emotional and spiritual issues in their grief, and we follow families. Medicare says for 13 months. We follow them beyond that if they need that with our bereavement center. Don't be afraid of it. I understand it because, like I said, when my husband needed it, I'm like, oh no, we're not doing it. And about a day or two later, of course, we did it, right? And I was so grateful. Even as a hospice nurse for so long, I needed that support. I needed to have somebody I could call and validate that, yeah, this is what's happening. People are afraid that when they call hospice, the person's going to die. The person's going to die with or without hospice. And
It's not giving up, it's giving care.
It's not only about dying, but it's about living
Right.
until they die.
And just increasing the quality of life, or
Maintaining a quality
easing
of
them
life.
into something that
To that
doesn't have
point.
to be so traumatic. I think.
Well, that's
the
it is, and
family support is just
we keep
valuable.
talking about the family support, the idea of something being traumatic, it passes along to the caregivers as well, because I mean, I have been in an ER when those measures are being taken, and that's awful to have to be there and witness and have to make the decision about, do we do this? Do we do that? I don't want to be the person standing there, but I'm the one who was at that point. But it's just like, if nobody's there yet,
You got to make it.
you got to make the call, and that the person who's down doesn't get to make that call because someone else is there, and you're supposed to know what they want if they're unconscious, something like that. The idea of having to go through that versus, it's hard. I'm not gonna sugarcoat this. Being in a hospice for the family is hard.
Yeah.
it's hard because you're dealing with that. But your facility, I can say from a personal experience, your facility and the people make it easier because of the calm setting, because of the people are good, because they make sure you have what you need. The family has what they need. It is as much taking care of them as it is taking care of the patient.
Yes.
And I think that's what separates it from hospital.
And maybe that's another thing to just point out, that if you haven't told people what you want, to get those wishes out there. Because you said that, and I thought to myself, God, we had no idea. Like my sister died suddenly. We had no idea what she wanted.
It's funny. I did a presentation to Wright State School of Medicine about Atul Gawande. We watched a presentation he had done about having the conversation why do you choose to pursue aggressive treatment and why do you not? And I said to the students and the residents in the audience, how many of you have advanced directives? No one. How many of you had this conversation with your parents and know what your parents want? Maybe a third.
Yeah.
I said, keep in mind, you never know what's going to happen. You never know. You could be in a car accident on your way home tonight. And does your family know what you want?
People think I'm 25, I'm fine. I don't have to worry about that yet.
Yeah. And the sad thing was 2 days later is when 3 days later was when my daughter had her asthma attack.
And did you guys had
that conversation. No. She was 28.
And you worked in hospice.
And you know about
years.
it.
Right.
I mean, imagine the people that don't get it.
Yeah.
And I'm the first one to say I don't have this stuff. Well, I do. I have like power of attorney and stuff like that all set up, but I don't have I don't have the other I don't have a will.
You don't have your funeral pre-planned.
No, not really. I figured I know where they know where to dig.
There's a song. We know what to follow.
Yeah. Play this.
Golden Wings and lighted signs.
She's talking about I think it's a Woody Guthrie song called Forest Lawn. Yeah.
But I do think it's important.
Topless dancers with golden wings, stuff like that. It's a pretty interesting song.
That would probably align nicely for you.
Way up there.
We're gonna have guys though, just because it's a little more socially accepted for them.
All right, there you go. Go ahead.
I was going to say, I had the opportunity to have that conversation with both my parents, and my sisters were present, so all of us were in the same room. We all heard the same thing.
That's a huge thing too.
And they signed their advanced directives. They told us what they wanted. My dad said, I had open heart surgery when I was 55. I was on a ventilator. Don't you ever put me on a ventilator again.
No.
He was clear. And about a year later, he had a cardiac arrest at home eating dinner. And they called the squad, of course, because it was very acute, right? And he hadn't gone into arrest yet, but en route to the hospital, he got cardiac arrest. So when we got to the hospital, they were resuscitating him. We were able to say clearly, no. We knew it's what he wanted, and there was a great comfort. I truly felt in saying no, that was our final gift to our dad, right? Please stop doing that to him. He doesn't want it.
It's what he wanted. That's his choice.
And I think that's the kind of thing that even if you could make a video of it or some kind of record, even, just so it's not one person in the room. Like you said, there were other witnesses.
Everyone heard it.
You have to have everybody hear it. That's been the biggest nightmare in my family, is that there's one who hears it the way they want to hear it. And then there's the reality of it, and that's really hard to manage. So having everything on paper made a big difference with a lot of that stuff. So the other thing that we're coming down to the end of our time here, but tell me a little, just very quickly, tell me a little bit about Dayton Hospice. What is it all about?
Sure.
I mean, we've talked about the services and everything, but tell me about the organization itself.
Ohio's Hospice of Dayton was founded in 1978. It's one of the oldest hospices in the country. And it was founded by a nurse. She was doing her master's thesis, actually, very small, at Wright State, and did a pilot project on hospice because she had cared for her mom, who was dying of lung cancer prior to this. And it was awful. And she said there's got to be a better way, because she was the only medical person in the family. So a lot of that responsibility fell on her.
Yeah.
So she did this pilot, and it was the start of Hospice of Dayton. And it's been an organization that's always been very mission driven about caring for people at the end of life and making it as good as it can be for the patient and the family. Our mission is that, we serve, and provide superior care and service to those we are privileged to serve. So that's our mission, to provide superior care and service to every person we have the honor of serving.
And the grounds on Wilmington Avenue in Dayton are just fantastic.
Phenomenal.
Very nice space.
Our community has been such a huge support financially and through volunteering and memorials that they purchase that are at Hospice of Dayton, in Wilmington. We couldn't
you
do it
have
without
everything
the
from
community.
wall memorials to
Mhm.
what do you call that? The artwork that's put on. What are those called? The artwork. You know what I'm talking about? That
Right.
stands upright. It's got like tiles in it.
Right. We have those out in the
a
around on the
mural?
grounds.
Around in the grounds.
Yeah, that they can
Mhm.
purchase it, and their loved one's name is on there, and their different costs and stuff.
And then the
they're-
stones in the ground, you have those
Stones, mhm,
engraved and all those sorts of things. So
people can honor their loved ones by doing rooms and such when we do remodels or expansions, that sort of thing.
I love that facility just because it allowed you to not leave the grounds and still have a peaceful place. There's a lake and there's a little fairy garden. I mean, it's just so many little niches where you can just sit
my
and kind of be
nieces
by yourself.
put a blanket out there, and they had all their kids there, and they were
They had a
having a little
picnic.
picnic there, and then they would take turns. Of course, we were doing that in the middle of COVID, so we could only go in, a very limited number of people. So
Right.
it was easier for them to be able to be there, and
for
then they
kids
would
to be outside.
and they would
on
go,
the
and the
grounds.
kids. We didn't want the kids in the room anyway. So they came to the window, and they had seen him recently, so that was helpful. This was talking about my dad, but thank you. That all works out well, and I'm gonna throw my piece in there. I know our episode's running a little long, but that's okay. It's worth it. This is an important
That's
thing
fine.
to me, and you can edit out some of my nonsense. That'll help.
I don't remember too much nonsense.
There's not too much
today.
nonsense in this one, but I have to say, from a personal standpoint, and I've approached everything we do with Old Nerd from a basis of here's what I've experienced. That's how it started. It began as a blog to try to keep me interested in my workouts, and then it became people at the gym asking me how I could help them do what I'm doing, what I did for Dad for them. And I'm not a personal trainer. I wasn't able to help, but they were watching and like taking notes and stuff, so I started writing it. But
Yeah, he was a celebrity at our gym. Every time we come in without him,
Dad,
they're like,
Dad
where
was a
he?
celebrity. Dad was the
Yeah, every
celebrity.
time he wasn't with us, they'd be like, where
Was
is
he
Why isn't
okay?
he with
They were always like, and it'd be not the day he was supposed to be there anyway. So it's like, no, he's home. Everything's fine. And it was kind of hard because when we got down to when I finally reached out to you, we were having a lot of trouble.
Yeah.
That last couple of days before
It was tough.
we came to your facility, it was really, really hard. And I think that's the part that my family didn't see. They didn't see how bad he was. They didn't see him all through the night. They saw him when he was up and awake and alert and eating some soup or whatever, and that's when they would visit. And he looked fine, and because that's the facade he put on.
That was their lens.
That was their lens, and that's what
they're not
he
privy
wanted.
to 3:00 in the morning.
They're not, and he wanted them to see that. He didn't want them to see what I saw. And by the time I got to the point where I reached out to you, we were going to do as I said earlier, we're going to do the respite care. And that's when you started, you talked to the nurse and you looked at all the stuff that I had sent you, and you said, this is not respite care. It's time to come in. And
with the hope that we were going to get him comfortable and send him back home.
yes,
Right,
that was the
goal.
idea, but I knew that because that was,
Yeah, I think the initial idea was we figured 3 to 5 days, and then he'd probably
and
be
he'd
okay.
probably be
to
home
come
for a
back.
little while, and but I for whatever reason I knew that was going to be it, because that's why I wanted you guys to see him, to see if what I thought in the back of my head that I wasn't willing to say out loud was
Right.
really what I was seeing.
Yeah.
And after you've gone through it once, you know what that looks like.
Well, that's another thing that they can offer is knowing those signs.
Yes.
The expert
Right.
opinion of this is common.
And
this
there
is
are
what's
consistent
normal
signs.
that we see all the time, and this is what point
Okay,
we're
I'm going to
at.
throw this one at you because this is one of the objections from the outside world. Okay, you made up the signs to suit your mission.
The signs meaning the physical signs.
You put all the math together to say this is what's gonna, and then you start doing what these folks are calling death care. That is absolute and utter BS. There's consistency when the body is declining.
Absolutely.
It's just how it works. Did you know I spent 2 years in pre-med?
I did not know that, but it's true.
And then he
hated
spent
it.
4 years in caregiving.
I
so
I
10.
spent 11 years in caregiving. But that's the thing, is that people see this stuff and attach it to one thing, and they get this weird sense of, I don't know where they get it from. It's just nonsense. Well, that's what they said about my mom, but she would have lived another 2 years. No, she wouldn't have, whoever this was.
Right.
And that's the kind of stuff I want to make sure that we clear up.
Right.
That's what we're
Right.
doing here today. So that's all I have. Do you have anything else you want to tell the people? Go buy your book.
Go buy my book.
Go buy the book.
I also do speaking, and so that's been a real privilege. I recently
great.
spoke
Yes.
for a Catholic, able to educate people about that.
And the adults
so,
who are grieving don't talk about it.
right.
Can you buy
Pot and kettle,
My
right.
question is, can you buy the books as a set? Like
Yes.
all 5 of them, or
Yes.
all 4, whatever you
Yes,
have
and
at
we
the
can do
moment.
that.
And then you can maybe donate them
Well-
to your local hospice.
Or to your local elementary
You
school.
give it to the
Library.
kids.
Right.
The
Yes.
hospice people don't need them.
No, I mean
Well,
for
we
the
use it
children
for
that are
bereavement.
there.
She knows how to do that.
For the children that are there.
Oh, I see.
to
Right,
give
right.
to them
Yes.
to
It helps
read.
them to understand what's going on.
You know, like the highlights at the dentist, this would be more, specified for that area.
Well, yeah, it's got a right. I don't know what to say to that.
Our bereavement staff do use
That
Yes.
okay.
Thank
Yeah.
you.
after the death. Yes, you're
What
right.
else do you have, Julie?
I
Do you,
think that's all
is
I
that
have.
it? Okay.
Do you have a website where we can get the book?
We're
or
gonna
just
put
Amazon?
all that on there, but whatcloud.net.
Whatcloud.net.
If you want to go straight there and don't want to have to wade through our nonsense to get to that, but please make sure you go check those out.
All right.
And
Thank you, Kim. It's been very helpful.
hospiceofdayton.org if you want information on that if you're in this area, or if you need help, reach out to your local hospice. Talk to them, talk to your doctor. They can help you find somebody if you don't know. And if you need those kinds of things, somebody's going to have that information if you're because we reach all over the country. I don't know who's going to be listening. So
We frequently say go to your council on aging or your local
whoever your local organization is that will help you with
organization
those
on
things.
aging,
there's
they can find you.
The
Thanks.
National Hospice and Palliative Care Organization has a list of all the hospices
you
in cities across the country as well. So
And
that's
you
another
can
place to check.
Just Google that. That's easy enough.
National
We'll
Hospice
put that on the
Care
website too.
Organization.
Yeah, we'll put the National Hospice on.
All right. Well, that's Old Nerd in the Gym Fitness Podcast for this episode. Say goodbye, Julie.
Goodbye, Julie.
Thank you, Kim, for joining us.
Thank you.
We
I've
appreciate
forgotten
it.
the tagline for this one.
You don't remember the tagline?
Get up and get out there.
There you go.
I got it.
See you next time. Thanks, everybody.